can you manage menopausal symptoms naturally if you don't want to take hormones? Another question about menopause and hormones. What would be the optimal time of day to take progesterone and estradiol?
Assuming this is for hormone replacement therapy, progesterone in general in the evening, especially if it's an oral progesterone, and then estradiol does not matter as much.
And then this one, does progesterone or estrogen dominance result in a different body shape for women?
It can, but not necessarily. There's so many things there's so many different vectors that determine a body shape that often there's another vector that is influencing it more. In menopause, often one of the large determiners is actually a lack of androgens. Many patients that come in and say they feel like they're turning into a male are actually depleted of androgens rather than have too many.
Yeah, and there are some characteristic patterns of weight gain in menopause where you have a lack of estradiol and then some adipose accumulation around the midsection, and those things are fairly well understood, but in general, probably your genetics and where you have historically carried weight or where your family has historically carried weight is going to be a bigger effect size than your hormone balance. This one says, should all women try to increase their progesterone levels? I hear a lot about estrogen dominance. How do I know if I have this?
Unfortunately, it requires lab testing. So diagnostic tests will tell you occasionally a female or a male will feel like they are particularly estrogen dominant, and it is not the case. So it's quite hard to tell, just like it's quite hard to tell for many men if they have symptoms and if they truly do have low or high testosterone.
Right, and for women specifically, I think it's important the way that they go about getting the blood work. So when would the optimal time for someone to have these hormone levels checked be?
Checking a progesterone between day 21 and 23, ideally. It's very easy to miss the spike of progesterone during the luteal phase. One other note about progesterone is higher is not necessarily better at all. Many women feel sleepy after taking progesterone, especially if they take progesterone not before bedtime. That's why people do take it before bedtime. And then some people have mental or mood changes while they're on progesterone, especially a high dose of progesterone.
And then someone asks, can you manage menopausal symptoms naturally if you don't want to take hormones?
Yeah, it's possible, and many people do successfully. It is not near as powerful of an intervention, but it can be a fairly safe one when you do it, especially in part with a healthcare provider who is knowledgeable about those various supplements. The better functioning your adrenals, and this is a rule of thumb, not a rule across the board, but the better your adrenals function and the more DHEA and peripheral estrogen that you produce, often the easier it is to manage menopause without HRT.
Yeah, so I sort of think of the adrenals as the body's backup system, and you do see a bit of an uptick when you look at the data in that those adrenal steroid production when women are going through that perimenopausal and menopausal phase.